How will you tell a pregnant woman to alter her lifestyle to stay healthy during pregnancy?
Yeah, this is my favorite question. So diet, the first thing is the diet. First thing, it should not be eat for two. I mean, you should eat for yourself, and just 300 extra calories should be there. And
But you're breaking a myth here, doctor. I mean, because in our part of the world, you know, we are taught when you get pregnant, you have to eat for two people.
You got a certificate. Eat anything.
Hello and Assalamu alaikum. Sehat hai to sab kuch hai, which roughly translates to health is wealth. And with this, we bring you a new series called Doc Talk, where we are going to be getting you the best and the best of the experts who will give you medical advice. We have with us today Dr. Bushra Gul, an obstetrician and a gynecologist at Zulekha Hospital, Dubai. Dr. Bushra has an experience of 20 years in Pakistan, in Saudi Arabia and the UAE. Our topic for today's episode is fitness and exercise in pregnancy, which goes in line with the concept of Zulekha Hospital, eat, play and laugh. Doctor, pregnancy is a major event in a woman's life. If there will be lots of changes in her body and all that. Let's explain to her what is going to happen to her body once she gets pregnant. How can she recognize the signs of pregnancy?
Thank you for inviting me, and I'm really happy to be with you. Definitely, there are signs and symptoms of pregnancy, and especially for a girl who is becoming pregnant for the first time. Definite diagnosis of the pregnancy is by the pregnancy test. I mean, you can't predict by the symptoms that she is pregnant or not. The classic signs of pregnancies are missed periods. However, this could be misleading if women has irregular period. Other than that, soreness of the breast, which is the same which we feel pre-period breast soreness. And other than that, there is morning sickness, but it can strike any day of any time of the day or the night. I mean, it doesn't have to be the morning only. And there is a fatigue, and
this morning sickness is mainly during the initial days of pregnancy, is it?
Exactly, till 13 weeks it peaks and it just goes away. And there's a fatigue. I mean, that's very common. And some women, they found themselves urinating more than other women, other than usual. Yeah.
Okay. So these are the normal kind of changes. And now she's pregnant. We assume she is pregnant, and for a pregnant woman, it's going to be 9 long months. So what do you suggest? What do you recommend? Are the symptoms that are going to be abnormal, and you'll tell her this is the time that she has to go and see her doctor?
Exactly. One thing, the education during the pregnancy, it's very, very important. I mean, to know what is normal, to know what is not normal. The pain, there could be some kinds of pain which could be just normal, like pelvic girdle pain and ovarian ligament pain, but some pains, they are the red flag signs. Like if somebody has pregnancy which is not inside the uterus, it's extrauterine, that pain will be severe and may be associated with the fainting or other shock. So all the pains, at least women should talk to the doctor about, and they will explain them further that what is normal and what is the line between normal and abnormal. Other than that, bleeding any time during pregnancy you should consult the doctor. Doctor might examine you and they might reassure you that everything is just normal, or they can have some diagnosis or some precautions for that certain kind of bleeding. Same, there is a leaking. If water discharge is there, if water is coming out, then also you should consult the doctor. They will examine you and then they will decide, I mean, just a normal vaginal discharge, or it's just abnormal water, or it's a baby water.
Right. So doctor, you're talking about there is pain, there is bleeding and vaginal discharge.
Should be ignored unless consulted and reassured by the doctor after examination. They should be taken as concerns.
Yeah. So the first question probably any pregnant woman is going to ask you, why are these symptoms happening or taking place? You know, so what is the normal answer to such?
Because these are three different things, and there could, for each of the thing, there could be range of the things. Like even for the bleeding, it could just be normal bleeding when your baby is trying to burrow into the uterus. So bleeding can happen, but only it should come after examination and by the doctor. Women cannot just assume that it's just this bleeding or this leaking or this pain. They should consult the doctor and they should come to the conclusion. And other than these symptoms, there are a wide array of the symptoms like headache. There's a range, the normal one and then abnormal one. Itching is most of the time it is abnormal. It should be consulted and taken seriously, and only you should get reassurance once you are.
Itching is like anywhere in the body?
More in the palm and soles. This is of concern, especially the population in Pakistan, India, Bangladesh. We have obstetric cholestasis high risk, so it should always be consulted and discussed with the doctor.
Okay, I don't think many women know that thing, so that's a very important tip that you have given.
And
so
their baby could be at jeopardy if they had that certain diagnosis.
So basically the thing is, if these symptoms happen, what they have to do is go to a doctor and
exactly
get examined.
Only they will do some investigation and they will come to the conclusion the condition exists or not.
All right. So doctor, I'll just move to another question, which is like, how will you tell a pregnant woman to alter her lifestyle to stay healthy during pregnancy?
Yeah, this is my favorite question. So diet, the first thing is the diet. First thing, it should not be eat for two. I mean, you should eat for yourself, and just 300 extra calories should be there. And
but you're breaking a myth here, doctor. I mean, because in our part of the world, you know, we are taught when you get pregnant, you have to eat for two people.
You got a certificate. Eat anything. This is the reason. This is the reason. I mean, we are obese. Once the woman is pregnant and they deliver, we just we are high risk for diabetes mellitus and all those things. This is because of our culture. So it should be eat for one and 300 extra calories, and just imagine like 300 extra calories are not much. I mean, just few healthy snacks like apple, orange, or few fruits you just added, or maybe a little bit of grain you added, or little bit protein. It's not very big. It should be just the normal healthy eating. And other than that, there's some food which should be limited, like fish should be limited, liver should be stopped completely, even when you're trying to get pregnant.
Really? Why is that?
Because it has vitamin A, and there's certain condition. I mean, there's certain abnormalities like air malformed, and there's certain other abnormalities in the baby which happen due to vitamin A. So any prescription which has vitamin A in a bigger dose also should not be taken by the pregnant women. And same for liver, because it contains high dose of the vitamin A. It should be completely stopped during pregnancy. And there shouldn't be any raw egg or raw meat. So mayonnaise has raw egg. It should not be taken because it carries the risk of salmonella. And smoking should be stopped or try to cut off. Recreational drugs and alcohol, all of that should be tried to minimize or stop, the better one. And other than that, all the vegetables.
Okay, the vegetables are there.
They should be washed because they carry some germs. And other than that, there's some cheeses which is not much common in our culture, like any fungus cheese like blue cheese or the white cheese like brie, camembert, roquefort. They should not be taken by the pregnant women also. And sushi
as well, because
now people are just raw fish can be taken if it has been stored for 5 days in the freezer. So once you go the restaurant, you can just check with them, is it a stored fish? If it's a stored fish, you can take it.
But we have a culture of having a lot of fried food as well. We have lots of fried
It's too
food.
wrong.
So,
That's wrong for everyone. Yeah, like oil should be first the choices of oil, olive oil, flaxseed oil because it's very rich in omega-3, or canola oil. I mean, that should be the one which should be either in your salad dressing or for cooking. Also overall, oil should not be more than 20 to 30 ml because like all the pregnancy risks are also translated once you're taking the wrong diet. I mean, even in the pregnancy, people get a lot of diabetes during pregnancy, and it's very frustrating. Like when you tell women that your sugar is high, now you have to monitor yourself each day 4 times, and they just get surprised after this that, oh, that free license to eat is gone. I mean, actually it's a monitoring. It's like they have to be more vigilant. And pregnancy, it's not a disease, but at this point they start taking it as disease.
Yeah, exactly. That's the mindset. So probably that's why we are having this talk, that we can educate people that these things are normal and this is not normal. So doctor, diet and exercise, they go hand in hand. So what do you recommend as an exercise for pregnant women? Again, I'll say we have a myth. We believe that, you know, exercising during pregnancy means we might be harming the baby. It's not healthy. We should probably spend the entire 9 months lying on bed, and that will be the best for the baby. What do you say about that?
Yeah, it was old culture and old saying, like, but this is changing very vastly throughout the world, and now there are cutoffs, like there are determined time, like all the colleges around the world, they say women should exercise 150 minutes per week. She can divide it 30 minutes per day most of the days, or 20 to 30 minutes, and it should be moderate intensity exercise, because when you do exertion, and if you see some women is doing exertion, she's actually producing lactic acid, and that acid is not good for baby. So it should be moderate intensity, and some people, they don't understand what is moderate intensity. So what they can do, it's very hard, everybody doesn't have pulse checking device. I mean, it should be less than or around 140, but they can, while doing
140 is
beats per minute. What they can do the talk test. If they are able to talk during the exercise or walking, whatever they are doing, then it's a normal one. But they should not be able to sing the happy birthday song. So they should do this talk test. If they are able to talk during the exercise, that's a perfect one. Another thing is perceived exertion. If your partner or your family member, anybody is looking at you and they see, oh no, I mean, she is fairly relaxed or she is fairly exerting, both things are not okay. I mean, it should just be middle way. Like it should look like exercise, but not too hard.
Right. So what kind of exercises do you recommend?
Because there are a few other changes during the pregnancy, like the gravity balance, it shifts because there's a bump and it's not in the center anymore. So there shouldn't be any risk of falling. Like if they have to do the cycling, it should be stationary cycling. It shouldn't be cycling.
She can cycle.
Yeah, she can be off balance because there's too much risk. And she can do stationary cycling, not the cycling on the road. Walking is very good. And other than that,
they say that even walking, you know, it makes the birth process really easy.
So it's easy, yeah. Especially it makes your posture normal, and the pelvic tilt, all the abnormalities because of the bump, you just get some low doses. That is like you get a curvature because your bump is just, so when you walk, it just comes a bit normal, and there's a chance then baby will be in the right position. Even it's not just head down is not all that matters for the position of the baby. Actually, it should be spine of the baby, back of the baby should not be same as your back. Your back and baby's back should be opposite to each other. So these positions are ensured if you're doing the right exercises and right posture. Like women shouldn't be sitting the cross leg, they should be always straight legs, and the positions should be proper, and like they can assume that there's a thread in their tailbone which is just passing through the whole body, and they can just straighten it out. So if they maintain that kind of posture, it will help them in the birth as well.
Really? Yeah. Okay. Other than that, what about some of them? I know a couple of women, not a couple actually, more than that. They're weightlifting, they're actually doing a lot of other heavy exercises.
Yeah. For this recommendation is that if you're doing all that from before the pregnancy, you can continue. Because it's your body which is trained. I mean, you should always listen to your body. I mean, some people, they just start and they say, no, it's not my body. I mean, I'm not that person. So you should always, whatever you're doing, you should always listen to your body, like, is it coping with it or not? So those people who are already doing all those things, they can continue, and their pregnancy outcome these days, I mean, their reports, they're good.
And so after they deliver, they can continue with the exercises as well. I mean, soon how?
After the delivery, the pelvic floor, you see there's a pelvic floor which really get involved in the birth process, and if it is weak, women have a lot of symptoms. The most common is the urinating, like you just leak urine voluntarily. So what they have to do, they have to do the pelvic floor exercises. This should be resumed immediately, but the other exercises, it depends, like they should slowly increase. And one more thing, if you have cesarean section, you should wait at least 6 weeks, and it should be slow increment with the milder exercises, and you should progress slowly.
Right. So basically it is listening to their own body and the doctor as well. Exactly. So it's a combination of both.
Exactly.
Right. So doctor, I have a few questions from my viewers, which I'll just put across to you. We'll take them one by one. This first question is from Batul Zehra. She's a mother of 4 children aged 1 to 3.5 years. And in fact, she has a couple of more questions, but we'll go through them one by one. So she asks, why do doctors not give advice on postnatal depression to expectant mothers during the pregnancy and after delivery?
Yeah, we don't spell or pronounce the word postnatal depression, but actually we do screen. Every time we go to the room, when we are making sure that baby has a bonding with the mother, we do make sure that she is in a state that she can take care of the baby or not, because postnatal depression affects everything. I mean, caring about the baby. So if we do screen these kind of things, then we talk to the husband or the family about it, or we even refer a patient to the psychologist. And we also make sure we switch some medication like Eldomet, which causes postnatal depression. If somebody is on that, we actually switch to another medication, Levotalol, which doesn't cause it. So we might not be talking to the patient about postnatal depression, but we do screen and we do have steps to make sure that she doesn't have it.
But my also question is, taking on to Batul's question, that why doesn't a doctor actually talk to the patient and maybe tell her that this is likely to happen to you? I don't know about statistics actually, but I think there's quite a huge number of women who have
postpartum blues are common actually. They're really common because there's sudden a lot of responsibilities, a lot of stress, a lot of work. So yes, but most of the women, they do cope and they come out of it. But the thing is, because this thing is not being talked about in our society. If at some point she feel concerned, like, because there's 2 postnatal checkup. One is immediately, and because same day you can't just make sure, because it slowly develops and it evolves. One is within a week and another is in the 6 weeks. Sometimes patient come and they do talk about, we do advise them. Another thing, referring somebody to psychologist is kind of taboo in our society. Sure. But it shouldn't be. Like, if you have some concern and you cannot make out, you should just feel free to go to psychologist, and rather going for medication, it's far better that you talk and let that moment of fear just come out of you and just be normal you.
So I know these questions are not related to our topic, they're not on exercise and fitness, but then again, it's not every day that we get a chance and my viewers get a chance to talk to an expert like you. So again, Batul has another similar question. Why do doctors not encourage husband participation during the entire 9 months of pregnancy and ask them to be in the room with them when they're consulting the doctor?
Actually, it's happening most of the hospital. It could be some individual hospital policy. We do encourage husband. Actually, when they are not around, we just tell them where is the guy who will see the show, because we have a show on the ultrasound, and I mean the family enjoys it most when both are there. I mean they just enjoy all the parts, and sometimes.
So basically, even the patient can ask if
it should be there. Okay. It's a standard care. I mean husband. That's the reason. I mean we always talk like you guys pregnant. We don't say that she cannot be alone pregnant for sure.
Exactly. So doctor, there is another question by a viewer who wants to remain anonymous, and she says, I'll read it out to you. I am married and it's been 3 years since I've been trying to conceive, but no luck yet. I'm overweight since childhood and I'm now 31 years old. Height is 5'1" and weight is 85 kilo. I'm walking 4.5 kilometers daily and all my tests are clear. Should I join a gym or cardio? I'm very shy and I can't share things even with my own sisters. So basically she's been trying to get pregnant for a very long time.
We actually talk a lot of issues. First thing, if you're considering to have a baby, then normally per month your chances are 15 to 25%. But it is affected by age and the time. If it's been more than a year, definitely, I mean there's some problem, and the coitus frequency. I mean sometimes like patient comes and they're just not living together, but they count their year of marriage. It's not okay, yeah. Other thing, she talked about weight. When you talk about weight and subfertility, it's like polycystic ovarian disease is something which comes in your mind. But then she said that her all tests are normal. Then there are 3 things to be pregnant. Husband test should be normal, tube test should be normal, and hormonal test should be normal. Weight itself doesn't stop women getting pregnant. We have done cesarean on 125 kilo women. I mean she wasn't very tall. I mean she's one. So it's itself per se, it's not a reason not to get pregnant. And if she is doing so much effort and she's not losing weight, so it looks like there's some thing in the jigsaw puzzle which is not solved. Probably she has some hormonal problem because she's making a lot of effort to lose weight. So if she's polycystic ovarian disease and she's not losing weight, then some medication can help, like glucophage. So she should have an opinion from the doctor. She should discuss that what is the relation of the weight with her not getting pregnant, and if she is doing so much effort, why she is not losing weight. If she's not losing weight, is there a hormonal problem? Or if there is a hormonal problem, can she benefit from glucophage or metformin?
Right. So basically what you have to do is go for another consultation and possibly tests, as the doctor has explained very clearly. So doctor, this is just the last question, and we'll wind up with this. Rabab is planning her second pregnancy, and she asks, is it safe to take the COVID vaccine now, since
yeah, actually anybody who is trying to get pregnant, we're just not giving COVID vaccine because it's just new thing. But if you got vaccine and you became pregnant, there's nothing. I mean, she can just go ahead with the pregnancy. Most of the pregnancy, they are good. Even COVID during the pregnancy, most of the women, they're tolerating well. I mean, they're just coming out of it nicely.
Well, thank you so much, doctor, for your time. And this was a short session, but I think it was really informative. Thank you so much again.
Thank you.